All right, diving deep into diabetes today. With this stack of articles, it looks like you're really trying to understand this complex condition. We've got symptoms of diabetes, a comprehensive guide, diabetes, symptoms, causes, and complications, a warning sign of diabetes, early warning signs of type 1 diabetes versus type 2 diabetes, and warning signs and prevention methods of diabetes. So let's unpack these and see what we can learn.
Yeah, great collection. Lots to uncover.
For sure. By the end of this, I'm hoping we'll not just know the different types of diabetes and the symptoms, but also, the risk factors, the long-term complications, and maybe even some surprising insights into prevention.
Sounds good. What should we start with?
Well, before we get into the specifics of each type, I'd love to just understand what's happening in the body, like at the cellular level. What causes this condition?
Okay, sure. So at its core, diabetes is a condition where your body struggles to use glucose. It's basically the main energy source. Imagine glucose as fuel for your cells, especially for your brain. But to get into the cells, glucose needs a helper, the hormone insulin.
So insulin is like the key to unlock the cell doors for glucose.
Exactly. Now, in diabetes, either your body doesn't make enough insulin, like not having enough keys, or the cells become resistant to insulin, like rusty locks. And this leads to a buildup of glucose in the bloodstream, which can cause a lot of problems over time.
I see, that makes sense. And I guess the articles break these different scenarios down into types of diabetes.
Yeah, type 1 and type 2 are the most common, and the articles do a good job of outlining them. Type 1, often diagnosed in younger people, is an autoimmune disease where the body mistakenly attacks its own insulin-producing cells. Like, the body sabotages its own key-making factory.
Right, and that means people with type 1 need daily insulin injections because their bodies can't make those keys anymore.
Exactly. It's a lifelong thing.
One article mentioned how quickly type 1 symptoms can appear, especially in children. It's like from perfectly healthy to needing insulin in a few weeks.
Yeah, it shows how important early diagnosis is.
Speaking of warning signs, I think most people know the common ones. More thirst, frequent urination, unexplained weight loss. But are there any less obvious symptoms that we should be aware of?
Absolutely. The articles highlight some subtler clues. For example, skin changes can be an early indicator.
Really? Skin changes? I wouldn't have thought of that.
Right, but things like dark patches on the skin, frequent fungal infections, like stubborn itchiness, even skin tags can be warning signs. It shows that diabetes can affect a lot of things, not just blood sugar.
Wow. Makes you realize that you need to pay attention to any unusual changes in your body.
Yeah, and these subtler symptoms often relate to the body not using glucose well. Like slow healing sores are another red flag.
So a cut taking weeks to heal could be a sign.
It could be. High blood sugar interferes with healing. It's like the body's repair crews have faulty tools.
Okay, so it's not just about sugar levels. It's about how that imbalance affects everything.
Exactly. And it affects the nervous system too. Several articles mention numbness or tingling in the extremities, like especially the feet, as a sign of nerve damage. It's a common complication called neuropathy.
That sounds serious.
Yeah, can be. Neuropathy happens when high blood sugar damages the nerves. It often starts as a tingling feeling, then numbness, making it hard to feel things properly. This can lead to injuries, especially on the feet, and increase the risk of infections and other things.
So it's not just the discomfort. It's the potential for serious problems later on.
Right. Early detection and management are key to, minimizing the risk of these long-term complications.
It seems blurry vision is another symptom tied to nerve damage, right? One article mentioned that.
Yeah. High blood sugar can affect the blood vessels in the eyes. It can lead to blurred vision and even, vision loss in severe cases. It's another reminder that diabetes has far-reaching implications.
So we've talked about type 1 diabetes and some of those less obvious symptoms. What about type 2? I know it's often linked to lifestyle, but is there anything in these articles that maybe challenges that idea?
That's a great question, and I think this is where these articles really shine. They go deeper than just lifestyle and talk about genetics and environment, too.
So it's not as simple as, oh, you have type 2 because you don't exercise or eat well.
Right. Lifestyle is a big factor, but it's not the whole story. Genes matter, too. Some people are simply more likely to get insulin resistance because of their genes.
So even with a perfectly healthy lifestyle, you could still be at risk if it runs in your family.
That's right. And this genetic predisposition can be affected by environmental factors, too.
What kind of environmental factors?
Like exposure to certain toxins, early life nutrition, even the bacteria in your gut. All these things can affect your metabolism and your risk of type 2.
It's like a bunch of different things coming together.
Yeah, exactly. And I think we need to shift the conversation away from blaming people for their choices and recognize all these different factors. It's about empowering people with knowledge, not judging them.
I agree. It's about supporting people to manage their health. Now, one article mentioned ethnicity as a risk factor for type 2. That was interesting. What did the articles say about that?
Yeah, good point. The articles say that certain ethnicities are more affected by type 2 diabetes, but they're careful not to oversimplify the explanation.
So it's not just genetics.
Right. While genes might play a role, it's probably also connected to social, economic, and cultural factors. For example, access to healthy food, affordable health care, and safe places to exercise can be different in different communities.
So it's about acknowledging those inequalities.
Exactly. And the articles highlight the need for a more holistic approach, one that considers all these social factors. It's about creating a more equitable environment for everyone.
That's an important point. It's about moving beyond individual blame and looking at the bigger picture. I'm really appreciating how in-depth these articles are.
Me too. They give a much more comprehensive understanding than we usually get.
Well, this has been fascinating, learning about the basics of diabetes. We've talked about the different types, some of the more subtle symptoms, and the complex causes of type 2 diabetes. I'm already feeling much more informed.
Agreed. But there's still more to explore. We should talk about the long-term complications of diabetes.
Let's delve into that in part 2. It's a bit of a heavy topic, but I think it's important to understand the full scope of this condition.
For sure. We'll give our listener all the information they need to make good decisions about their health.
All right, we're back, and we've talked about the types of diabetes and how they work, but now it's time to talk about the long-term complications. This might get a little serious, but it's important to know, right?
Yeah, definitely. Understanding the risks is important for prevention and management.
The articles are pretty clear about this, and it's a little scary. It seems like almost every part of the body can be affected. Where should we start?
Well, cardiovascular disease is a big one. A lot of the articles talk about the higher risk of heart attacks, strokes, and other heart problems for people with diabetes.
Yeah, one article said that diabetes can speed up the hardening and narrowing of blood vessels, which makes it harder for blood to flow.
Exactly. High blood sugar over time, it damages the lining of the blood vessels. It makes them more likely to get clogged with plaque. It's called atherosclerosis, and it's a major cause of heart disease and stroke.
So it's like the body's pipes are getting clogged.
Yeah, that's a good way to put it. And it's not just the heart and brain. Kidney damage is another serious complication.
The kidneys filter waste from the blood, right?
Right. They have these tiny filters called nephrons, and high blood sugar can hurt them over time, so they can't work as well.
And then waste builds up in the blood.
Yeah. And if the kidneys get really bad, it can lead to kidney failure, and then you might need dialysis or even a transplant.
It shows how everything in the body is connected. You know, how one problem can lead to others.
For sure. And the articles go beyond just heart and kidney disease. They talk about some things that might surprise people. For example, there's a connection between diabetes and Alzheimer's disease.
Oh, I didn't know that. I know Alzheimer's is a complicated brain condition, but how is diabetes involved?
We're still learning about it, but scientists think that insulin resistance, which is a big part of type 2 diabetes, might also play a role in the brain. There's more and more evidence that insulin is important for brain health, and when there are problems with insulin, it could contribute to Alzheimer's.
So it's not just about controlling blood sugar in the blood, it's also about making sure insulin works in the brain.
That's what it seems like.
Yeah.
And it shows how important it is to manage diabetes in a holistic way, thinking about all the different parts of the body, including the brain.
It really is more than just a blood sugar problem. It's a complex disease with a lot of effects.
Definitely. And we can't forget about the nervous system, like we talked about earlier. Neuropathy can cause a lot of different problems, from numbness and tingling in the hands and feet to digestion problems and even sexual problems.
One article talked about foot damage, which is a bit scary.
Yeah, when nerves in the feet are damaged, people might not feel pain or other sensations properly, so they might get injured or get ulcers or infections, and those can become really serious, especially because blood flow is often a problem in diabetes too.
So even a small cut or blister could be dangerous.
It could be. That's why it's so important for people with diabetes to take good care of their feet.
Like checking them regularly, keeping them clean, and wearing the right shoes.
Exactly. And if there's any problem, no matter how small, see a doctor right away. It's better to catch things early.
It sounds like managing diabetes is a lot of work. It's not just about taking medicine, it's about really paying attention to your health.
I agree. It's about being proactive and taking control.
Well, this has been a bit intense talking about all the complications, but it's important to know about them. It really makes you realize how important prevention and management are.
It does. And I think this is a good time to move on to our next topic, prevention strategies. What can people do to lower their risk of getting diabetes in the first place?
That's what we'll be discussing in part 3, right after this. We're back, and we've talked about a lot with diabetes. The different types, the symptoms, the causes, the complications. It's been pretty intense. But now let's focus on something more hopeful. Prevention. The articles you shared have some good strategies for reducing the risk, especially for type 2.
Yeah, for sure. We can't change our genes or everything in our environment, but we can make lifestyle choices that can really help.
Right, it's about focusing on what we can control.
Exactly. And even small changes can make a big difference in our metabolic health.
The articles really emphasize weight management.
It's super important. Losing even a little weight, like 5 to 7%, can significantly lower your risk of developing type 2 diabetes.
So it's not about huge weight loss, just making changes that you can keep up over time.
Yeah, exactly. Finding what works for you. And it's not just about the number on the scale, it's about reducing body fat because that's what's linked to insulin resistance.
And speaking of insulin resistance, exercise is supposed to be really good for that, right?
Oh, absolutely. When you're physically active, your muscles use glucose for energy, and that makes your body more sensitive to insulin. And it doesn't have to be super intense. 30 minutes most days of the week is a good goal.
So things like brisk walking, cycling, swimming, anything that gets you moving.
Yeah, exactly. And if you can't do a long workout, you can break it up into smaller chunks throughout the day. That works too.
One article mentioned fasting as a way to improve insulin sensitivity. What do you think about that?
Well, fasting has become really popular lately. There's still a lot of research to do, but some studies do show that certain types of fasting, like intermittent fasting, might help with blood sugar and insulin sensitivity.
So it gives your body a break from digesting food all the time, and that lets insulin levels go down.
That's one idea. When you fast, your body starts using stored fat for energy, which can lead to weight loss and, better metabolic health.
So it's like resetting your metabolism.
Kind of, yeah. But you have to be careful with fasting, especially if you have any health problems. Talk to your doctor first, especially if you're on medication for diabetes or anything else.
Right, safety first. So besides weight and exercise, the articles also talk about diet, obviously.
Yeah, what you eat makes a huge difference for blood sugar and your overall metabolic health. The articles recommend eating lots of whole, unprocessed foods, like fruits and vegetables, whole grains, lean protein, and healthy fats.
So less processed food, sugary drinks, and unhealthy fats.
Exactly. Those things can contribute to insulin resistance and weight gain. The idea is to make gradual changes to your diet, not follow some crazy restrictive diet that you can't stick to. Just make small changes over time, find a way of eating that you enjoy and that's good for you in the long run.
This all sounds good, but I imagine some people might feel a bit overwhelmed by all of this.
Yeah, I get it. There's so much information out there, and it can be confusing. The best thing is to start small, maybe focus on 1 or 2 things at a time, and don't be too hard on yourself.
Yeah, and you can always talk to your doctor or a dietitian for help. They can give you personalized advice.
Exactly. They can help you make a plan that works for you.
So it's about taking care of yourself and asking for help when you need it.
Yeah, and remember, prevention is a journey, not a one-time thing. It's about making good choices every day for your health.
Well said. We've covered a lot in this deep dive, from how diabetes works to the causes and the complications. But we've also talked about ways to prevent it and the fact that there are treatments that can help.
It's been a really thorough discussion. Hopefully our listener feels like they learned a lot.
I hope so too.
Mhm.
It's all about being informed so you can make the best decisions for your health. Thanks for joining us on this deep dive into diabetes.